He's out of New Milford, right? Yeah.
Yeah.
Yeah. Chris Murphy's Street. Okay.
That's okay, you know. We travel, we get around. And
Chris Murphy and I were taking the train from Danbury to Norwalk on Thursday morning to bring attention to the whatever it was, $30 million that got brought there for improve that line.
Last week, the New Haven Independent did a story on Chris Murphy, and he was talking about the fact that it's not time for Democrats to sit on their laurels and rest. It's time to come out swinging on health care. Just push it through in reconciliation, get it through the Senate with some changes, some serious changes to it, obviously. They've even shown signs in the Senate of perking up their ears a bit more to reconciliation for a public option. About 10 senators who are on the edge about that were talking about the possibility of doing it that way because they realize the imperative of doing it. It's not just a political decision now. It is a political decision, obviously, to have to get it because the majority of Americans want some sort of public option. If there's going to be a mandate, there's got to be a public option. Otherwise, they don't want one without the other. And the polls clearly show that across the states, especially in Connecticut. It's very strong, the opinions on that. How do you feel about that? Pushing some sort of public option through reconciliation and fixing what was in the Senate bill. There's some good stuff in there, like Sanders legislation. It's probably the crown jewel of all legislation, as most healthcare activists have said. But fixing the Senate legislation through reconciliation and then passing it off. How do you feel about that?
I'll start with this, which is that doing nothing is not an option.
Obviously.
And I have said, I have said that I would. There are things that I really dislike about the Senate bill. The Senate bill is way too easy on the insurance companies that operate in an oligopolistic environment. Unlike the House bill, of course, had a public option, which I supported. The House bill lifted the antitrust exemption that those companies have enjoyed for a long time.
That's a key thing.
It's a key thing. As controversial as the public option got, people lost sight of the fact that the CBO scored the public option as actually reducing the deficit and cutting costs in the healthcare system as an additional competitor. That's why I was a supporter of it. But I said that I would vote for the Senate bill as an alternative to doing nothing, because that, of course, is an option too. The House could vote for the Senate bill. Now, I'd like to see some of the things that are ugly about the Senate bill change one way or another. But if the alternative is doing nothing, I would vote for the Senate bill. We would also, and I think my guess is that this is where this is going right now. Although I've been out of D.C. for 2 weeks, so my information is a little stale. But I do think that there's a chance that they try to put together a bill that they then pass in the Senate with 51 votes using reconciliation. The opposition will say, a total abuse of the process, which of course is dead wrong, right? And we need to remind people that the Bush tax cuts passed through the Senate 2001 and 2003 using reconciliation. The welfare reform in the Clinton administration passed in the Senate using reconciliation. So there's a long history of fairly substantial changes to the way we do things passing through reconciliation. And the Republicans have shown that their interest here is not in being constructive and helping us get something done or compromising, but in derailing the process.
One of the things